Ever feel like you're drowning in information, just trying to, get properly informed on something complex? Yeah, you're definitely not alone. That's why we're here at the Deep Dive. We try to cut through all that noise and get straight to the insights that matter for you. Today, we're doing a deep dive into something really changing healthcare. It's called knowledge mobilization and these interesting co-approaches.
Exactly. And what we want to do today is really unpack how evidence, research and experience gets generated, shared, and crucially, actually used to manage health conditions better. We'll look at the advances, but also some surprising gaps that still exist.
Okay, let's start right there. Knowledge mobilization. What exactly is that in a healthcare setting? Why is it such a buzzword?
Right. Well, it's much more than just, doing research and hoping someone stumbles upon it.
Hmm.
Think of it more like an active process, collaborative too. It's about generating, sharing, and importantly, using evidence. And the really big shift, I think, is that it values all kinds of knowledge.
All kinds. You mean not just the scientific studies?
Precisely. Scientific facts, sure, but also patients' lived experiences, clinicians' practical wisdom, even values and beliefs. It's moving away from that old hierarchy where only, like, academic papers counted.
That sounds like a pretty fundamental shift. So, how does this big idea actually happen? What are these co-approaches you mentioned?
Yeah. That's where you hear terms like co-production, co-design, co-creation. They often get grouped together as co-approaches. While there are subtle differences, maybe you're creating the research question together or designing a tool or the whole process, the core is always collaboration, real collaboration. They're basically the answer to the knowledge to practice gap.
The knowledge to practice gap,
Yeah.
right? That's the problem where great research doesn't always make it into everyday care.
Exactly that. All this valuable knowledge potentially sitting unused. These co-approaches are designed to, well, build that bridge, get it to the people who need it.
Okay, so bridging the gap is the goal. But why are researchers and health systems actually doing this? It sounds like a lot more effort involving everyone like that.
Well, fundamentally, they're chasing impact, real-world impact. The idea is that the research findings will be more relevant, more usable. It cuts down on wasted effort, too. And ultimately, it's about improving how conditions like, say, osteoarthritis or cancer are managed. It becomes a two-way street for sharing knowledge, patients, clinicians, researchers, all aiming to, positively affect how things go for patients, for you.
Makes sense. So, digging into the details a bit, what's the secret sauce here? How do these approaches actually work? How do they bring everyone together effectively?
Well, what's really interesting is how they put that idea of valuing all knowledge into practice. The focus is really on bringing diverse people together as active and equal partners.
Hmm.
So it's not just the academic folks, it's the vital insights from doctors and nurses on the ground, and crucially, the experience of patients living with the condition. Studies actually noted this is potentially efficient in making use of all available knowledge, both the scientific and the practical stuff.
And I saw something really fascinating, this use of a creative approach. That sounds different for healthcare research.
Yeah, it really is. It's not just like whiteboards and sticky notes, though maybe some of that too. It often involves actual design practices, sketching ideas, drawing concepts, building rough prototypes together. It helps make complex stuff more tangible, more accessible. And studies found it really helped keep diverse groups engaged, even groups sometimes called hard to reach. It keeps people involved.
So my terrible drawings might actually have a place. Interesting. What does all this creativity and collaboration actually do, though? What are the mechanisms?
Good question. So these approaches seem to work through a few key mechanisms. First, they help everyone get on the same page, building a shared understanding.
Hmm.
This helps identify what people really need, challenging that old doctor knows best idea sometimes. It meets diverse needs better. They also help balance power and voice, those creative activities. They can flatten hierarchies, create a more inclusive space where everyone feels they can speak the same language, contribute equally, and all that builds a real sense of ownership over whatever is produced. Plus, crucially, trust and confidence among everyone involved.
Okay, so it sounds great in theory, more collaboration, shared understanding, trust. But the big question, the bottom line, does it actually make people healthier? Do health outcomes improve?
Right, that's the million-dollar question, isn't it? The authors of the studies we looked at certainly believe so. They felt these co-approaches created knowledge, products, guidelines, tools, whatever, that were more accessible, more relevant, more usable. And because of that, they were more likely to actually be implemented in practice. And some studies did show concrete changes.
Like what kind of changes?
These like clinicians being more consistent in how they assessed patients, sometimes fewer hospital visits, patients reporting higher satisfaction. So positive signs, definitely.
Okay, positive signs. But I sense there's a but coming.
There is, and it's a really critical one. Despite that strong belief and seeing some of those practical changes, the systematic review looking across these studies found, and I'm quoting here, no evidence that these co-approaches led to improved health.
No evidence, so they don't work.
Well, it's not quite that simple. It's not that they definitively don't improve health outcomes. It's that the direct link, proving that these approaches cause better health, that link is still largely unproven. The main reason seems to be a lack of really robust evaluation after the new tool or approach was implemented. We're missing the rigorous follow-up to measure the long-term health impact directly.
Wow. So this deep dive shows a really powerful promise in doing healthcare research differently, collaboratively, making things more relevant, more trusted. But it also puts a spotlight on this critical need for better evidence, for actually measuring if it makes the difference we hope it does in people's health.
Exactly. The potential is clearly there. Creating solutions that are genuinely tailored, that everyone involved buys into, that's huge. But to know for sure if these co-approaches truly move the needle on health outcomes in the long run, we absolutely need that rigorous post-implementation evaluation.
Hmm.
It raises a fascinating point, doesn't it? This gap between such strong belief and the current lack of hard proof for health outcomes, what stands out most to you about that?